Morning everyone. So today one of the things we're really focusing on this week and into next week is the vaccination rates for two groups where we've got quite low numbers of people who are eligible to be vaccinated who are actually getting vaccinated. So at the moment only 32% of people across GV Health's local public health unit who are in the 18 years of age plus or older age group have actually received their booster dose. So that's a really low number and it's something that we're working really hard to address across our area. And similarly, we have only 29% of children aged 5 to 11 who have come forward and got their vaccinations. As those numbers, I should say, are from earlier this week, for the week ending last Sunday. So they will have changed in the last few days, but they're nowhere near where we need them to be in terms of getting up to that 100% coverage area that we're looking at. So as I said, 32% of people 18 plus and 29% of people aged 5 to 11 have come forward and received their vaccination. So if you haven't made an appointment to get vaccinated, the best place to do that for the state-based hubs is coronavirus.vic.gov.au, or you can make an appointment by calling 1800 675 398. The other place, if you do want to have vaccination at a general practice clinic or a community pharmacy, if you simply search in any internet search engine book a vaccination now, that will open up all of the available places in terms of general practices and community pharmacies right across the country, in fact, but certainly in and around the Goulburn Valley area where you can get a vaccination. Yesterday we did Walk-In Wednesday at the Macintosh Centre at the Shepparton Showgrounds, and that was a really great success. We had over 400 people vaccinated during the course of that day, and that was mainly children aged in the 5 to 11 group. So well done and thank you to all of those kids who have come along and been vaccinated, and also to their parents and or guardians as well. It's absolutely what we want to see. This coming Saturday we'll also be opening the Macintosh Centre from 9 a.m. to 4 p.m. Appointments are available. You can book in those ways that I mentioned before. So if you'd like to know the time in terms of having some surety around the appointment time, you can absolutely book, but it's looking very likely that we'll also do walk-in appointments for the children 5 to 11 year old and the vaccination booster program for 18-year-olds and above. So as we're getting more staff now back into the Vax program, we are increasing our capacity. So keep an eye on the GV Health Facebook page. We are, again, in the coming weeks, we'll be running Tuesday evening sessions and the like, just to try and make it as easy as possible for people to come forward and be vaccinated. The other thing too, as I mentioned earlier in the week, is people who have symptoms. We know there are still some delays in when they've got symptoms to when they're coming to get a PCR test or a RAT test. There's plenty of access to RAT tests now across the Goulburn Valley area, so please don't delay that. As soon as you have any symptoms of COVID, like the cold flu type symptoms, no matter how mild they are, please come forward and be tested straight away. Overall, we have continued to see a flattening or marginal decline, in fact, in terms of the active cases in our community at the moment. So across, as of this morning, across GV Health's local public health unit, we're now below 1,000 cases, so just over 950 active cases, and 350 odd of those are in the Shepparton local government area, around 300 in Mitchell, just over 100 in the Moira Shire, and 44 in Strathbogie. Hospitalisations, however, have continued to remain at a fairly constant level. They are fluctuating in that order of around about 15 to 20 for us at GV Health. So as of this morning, there were 17 people admitted with COVID at GV Health, and 2 of those people are in ICU and 1 is on a ventilator. So if, again, that's another good reason in terms of being vaccinated. Vaccination is the best way to prevent you from ending up in hospital, and also, of course, of contracting COVID to begin with. In terms of our furloughed staff numbers, 84 people as of yesterday were furloughed. We're continuing to see operational pressures across all of those essential critical services, our emergency department into our operating theatre, maternity services, and of course our wards and our COVID wards. So although the case numbers in the community are starting to decline, and that's certainly our experience, that's the case statewide, but it's also our experience locally, we are still seeing it be quite busy in terms of hospitalisations for people with COVID and people needing care and treatment who don't have COVID. So please bear in mind as well, we continue to operate under the Code Brown that's in place right across Victoria. We're continuing to redirect and redeploy staff to those critical areas that I mentioned a few minutes ago. But of course, if you do have a life-threatening emergency, our ED will always be there for people in that circumstance. But having said that, there are plenty of other ways. If you've got a GP-like query or need some health advice, please contact your GP or nurse on call. There's plenty of good access to health information that people can get their hands on in those forums. So I'll stop there and take some questions.
What do you think is the reason for this, slow uptake of the booster?
I think it's there's probably a combination of a few key things at the moment as to why people haven't either got the booster or the 5 to 11-year-olds. So I think definitely the Christmas holidays and the New Year period has played a part in that. There's been people away and for whatever reason, travel, those sorts of things away on holiday. I don't think it's necessarily been foremost on some people's minds about getting their booster or coming in for the 5 to 11-year-old program. Some of that's also related to some challenges with access in the very early part of January, but that's really started to open up now. We're seeing in our PHU or our Vac Centre at the Macintosh Centre that there are appointments that are available. People just aren't choosing to book into them. So I understand that's part of also what's occurring more broadly across the state. So access is there. We just really want people to come forward and get either the 5 to 11-year-olds vaccinated, first dose, or the booster dose if they're eligible.
Do you have projections that tell you how soon this local public health unit could be boosted to a similar rate as our double vaccination rate?
We haven't done that analysis yet. It's probably a bit early in that regard. So yeah, but as I said before, to be sitting at around about 29-30% for the 5 to 11-year-olds and also the people who are aged over 18, we really just want people to come forward and get their vaccination wherever it's easiest and most convenient for them. But we have seen though, in terms of the second dose numbers, we were able to close that out pretty quickly in terms of the 5,000 campaign that we had last year. So I think perhaps watch this space. We'll be maybe doing something like that to really get some acceleration around those key numbers in the coming couple of weeks.
Well done.
Good. Thanks.
Thanks.